Good morning, guys. All right, we're all sparkly. Today, we're going to talk about the importance of nutrition in testosterone replacement therapy. We're going to cover the basics because it isn't that complicated. You are what you eat. If you haven't worked that one out yet, more for you. Every cell within this body is alive. So feed it. Feed it real food. Feed it with enough macronutrients and micronutrients. Understand the most efficient energy source is what? Fat. Yeah, but fat makes you fat. No, it doesn't. Excess calories makes you fat. Eating the wrong foods makes you fat. The basic laws of thermodynamics. Calories in versus calories out. If you want to gain weight, you eat more calories. If you want to lose weight, you expend more energy than you eat. So it's quite simple, really. Now, it's not to say you do not need a maintenance amount of calories. You have something called your basal metabolic rate, which means you need a certain amount of calories to live. Now, does that mean that you need to eat those calories every single day? Well, if you think about melandrin levels, you would go, well, yes, obviously, because they follow a diurnal pattern. But actually, no, of course not. We'd be pretty useless if we had to eat a certain amount of calories every day in order to live. Obvious, really. So, again, we are not efficient at burning calories. We're not supposed to be efficient at burning calories. We would be no good traveling across the plains, having to stop every 20 meters to have a Snickers bar. So when you look at that plate of pizza, oh, I like that pizza. Understand the amount of effort it's going to take to burn those calories off. So what we really need to do is have to shift of thinking. So when you look at your food, ask yourself, have I earned this? If the answer is yes, eat it. If the answer is no, don't eat it. Do I want it or do I need it? If you need it, eat it. If you want it, ask yourself, do you need it? It's all really quite simple. So, testosterone and nutrition. You are what you eat. But let's think about this from a testosterone replacement therapy perspective. Now, we are giving you exogenous testosterone and HCG to attempt to mimic natural physiology. Now, that is the purpose behind testosterone replacement therapy. Ergo, you need to look at all the other aspects of your life, your lifestyle, your diet and exercise to maximize the gains and the feel-good factor of testosterone replacement therapy. I've said it before and I'll say it again. It isn't a feel-good hormone. You've got to work your butt off to feel good. And ultimately, effort equals reward. I've said it before and I'll say it again. It can be disheartening not seeing the reward despite putting the effort in. My role is literally to guide you and support you. It's not to do the hard work for you. The symptoms that go with low testosterone, fatigue, low mood, the list goes on. We've been over it before, again and again and again, are multifactorial. Now, my job is simply to normalize your melandrin levels. Look a little bit further into the neuroendocrine system, give you some pointers to look at lifestyle, diet and exercise, But you've got to do the work. It's not up to me, is it? So put the effort in, you will gain the reward. If you're not getting the reward, keep moving forwards. If you're going to fail, fail forwards. So nutrition, it isn't that complicated. Calories in versus calories out. What foods are you having? Because it is a little bit more complicated than calories in versus calories out. Why? Well, if you've read Sapiens, you'll understand that we have an over-reliance on carbohydrates as a result of needing to feed the masses who are living in bigger communities than would be able to self-support through living in smaller communities. So carbohydrates fill you up. Sugars cause an insulin dump, insulin resistance, and you gain weight. What happens when you gain weight? You become a chunky monkey and you pollute your liver. What are the two organs within the body that you can directly influence how much testosterone gets converted to estrogen? You guessed it, body weight and liver health. So it's incredibly important to understand the necessity to maintain a good, healthy body weight and not pollute the organ that is detoxifying, metabolizing all of the wonderful nutrients that you're putting into your body. So give it real food. Do not have this over-reliance on carbohydrates that has become so deeply ingrained in our society. Sugar, you don't need sugar. It's highly refined, causes an insulin dump, causes that wonderful dopamine spike that we're all striving to achieve, not through effort, but because I can take it. I'm going to take that dopamine reward. I'm going to use food as a comfort blanket. I've said it before, and I'll say it again. Comfort eating. So when you eat, you initiate the parasympathetic nervous system, the rest, relaxation, social engagement nervous system. It's nice eating. That's why we do it. But you need to put the effort in to achieve the reward, which is food. But we like dopamine. Yeah, look at us. We're the sickest society on this planet. Our higher state of consciousness has done nothing for us. It's actually working against us. Animals, those simple animals, are so much more healthy than us highly evolved humans. It is frankly embarrassing. They are too busy surviving. They are too busy using their physiology how it's supposed to be used. We'll go back over this again one more time. The diurnal variation in your melandrin levels is purposeful. Your anabolic processes predominate overnight to rest, recover, grow, prepare for the day. You have an increase in your free testosterone in the morning and a spike of cortisol to do what? To go hunt, to go gather. We don't need to go hunt, go gather, but go exercise, be active. Doesn't mean go in the gym, just means be active to earn your reward. Ultimately, that is what this is all about. Using your physiology appropriately. We don't see greed in the animal kingdom. You simply don't. The Serengeti program, this old male elephant went to its resting ground to die. The lions came to feed. The lions let their fierce adversaries, the hyenas, also feed. Now, this wouldn't happen if food was scarce. When the lions did one, the hyenas let the vultures feed. Again, fierce adversaries in times of scarcity. However, in times of plenty, even these base animals understood that excess is not good. Us humans, more, I want more. I deserve more. I'm entitled to enjoy myself. Life isn't about hedonism. So it should be about being productive. It should be understanding our relationship with every other being, every other animal, every other thing in this planet. But we're obsessed with self. We are narcissists, and that needs to stop. So animals understand that excess is not good. So humans, with our higher state of consciousness, should also understand that excess is not good. Excess leads to obesity. Excess leads to disease. It's kind of obvious, but we are so incredibly stupid. So put the appropriate amount of calories in your body for your basal metabolic rate and energy expenditure. If you want to lose weight, eat a few less calories. Understand that you are not efficient at burning calories for a reason. If you want to gain weight and gain muscle, you've got to eat right, lots of protein, train properly. Again, your body is incredible, so you have to force change. Your body does not want to change. Force change. Train hard, rest well. Anabolic, catabolic. Super important to understand the need for what? Balance, baby.